Alright, this here is video number 1. Again, this is your foam rolling circuit, so this is something you can do before each and every routine, which I highly recommend you do. Give you a breakdown what we're going to be doing. I'll do a quick version of each and every stretch, just so you have an idea as to complete it and complete it correctly. I'm going to show you everything you can use first. First, the tennis ball. So if you don't want to purchase foam roller, that's perfectly fine. You can use this. It's going to be a little bit more focal, so it's definitely going to hit those pressure points a little bit more, but we will use this regardless. Then second, primarily here, this is your foam roller. Basically all it is a piece of foam. You can find these online just about anywhere. Type in foam roller, good and simple. Try to get one that's of a decent density so that it'll last you, so that it stays nice and firm. I always recommend the 3-footer. You can get 1-footers as well, more of a travel size. And if you want to go truly dense, you can go PVC pipe. I don't really recommend this one as much, main reason being obviously this is going to be very challenging, can be painful. So we'll leave this one out, but you can always substitute for the foam roller. So to get things started, I'm going to start off simply with the tennis ball. Again, you can use the tennis ball for everything, but first we'll primarily just roll out the feet. So again, as I mentioned, I'm going to do more of a quick version, just kind of go over things with you. Get all parts of the foot. You can do each foot, obviously. For the length of time you want to spend, it really depends. Females, for those that wear heels, you may find that the arches of your feet are a little bit more tense, so you may use this one a little bit longer. This is something to great have at your desk, especially at work. If you're on your feet all day, obviously that's not going to be as feasible for you, but it will work nonetheless. Next we'll move on, we'll do a quick full body circuit. Again, you can spend as much time as you'd like doing these. I'm going to give you the quick version. I'm going to give you a side angle so you can kind of see how it works. Hopefully everything will come through for you. So starting off, we're going to start off right past the feet. We're going to do the calves first. This one can be a little challenging on the upper body because you have to slightly lift up, but I want you to make sure those shoulders stay down and back. Then all you're going to do is you're just going to roll right along that calf muscle, just rolling back and forth. As you walk forward, you may need to put your foot down and walk your arms forward, depending on the length of your arms. Simple and straightforward. What you can also do is you can internally or externally rotate those feet so you can get all parts of that calf. And if you need a little extra intensity, take one leg, cross it on over the next, and you can really get it, and especially really getting on the outside and all parts of that calf muscle. Usually the calf can be a little bit tight, especially where that muscle starts to bulge out, but that will really depend on your level of tightness. Continuing on, we'll do the hamstring. Again, this one you're going to lift up. Simply slide right along, right to the base of that butt, and then slowly on back. So you're just going to do that. And again, same thing here. You can cross one leg over the next, making and adding a little bit of intensity, because for a lot of people, hamstrings are either very tight or not tight at all. Moving forward, I'm going to start off. You're going to sit right on top. So this is going to require a little bit of a balance. So at first, it may feel a little uncomfortable, so just play around with it. Whatever side you're going to be on, we're going to start off with that leg nice and straight. This is just going to help kind of open up the hips and really get into those glutes. When you're here, you may not feel any tightness. If you don't feel any tightness, that's fine. We'll get there soon. But if you do, just kind of roll around and really kind of roll back and forth so you can get all parts of that glute medius and glute max. Next, what we're going to do is whatever side you're on, you take that leg, you cross it on over. This helps to open up, get you into that piriformis, which is almost kind of about a walnut shape, so you may feel one bit that's a little bit tighter than the rest, and then when you get there, you hold it. Anytime you have tightness, you really want to try to hold it on that spot until it decreases about 50 to 75%. That's going to help the blood flow more freely, and it's going to help to kind of limber you up. And especially since this is part of our warm-up, it's going to help to kind of get the blood flowing and get your heart rate up slightly, get those muscles nice and warm. Next, one that most people truly enjoy, we're going to do the mid and upper back. I do not recommend doing the lower back. That'll be a topic of discussion for another day. But starting off, you're just going to lay on back just like so. You're going to lift up, weight through the heels, try to get that upper body nice and parallel. Now you have two options. You can have your hands up here, you can give yourself a big hug. If your hands are here, when you get to those shoulder blades, bring those elbows together, and when you're here, those shoulder blades are already retracted in. You just roll up right towards the base of that neck or wherever is comfortable, then slowly roll on back. Just going back and forth. One thing you can do is you can roll side to side so you're not strictly just on your spine, and so you can focus more on your left and your right side And again, that's one most people truly enjoy, so spend some time there. Moving forward, we just got a couple more. What you're going to do is, everyone's got that kind of bone protrusion of the pelvic bone. You're going to go right below that to hit those hip flexors, or the TFL. You're going to just get right on down. You're going to get set here, and you're just going to roll around slightly. For some, you may find a significant amount of tightness. For others, you may not. You kind of got to roll around, you got to find that. Once you find it, you're basically going to know it. It usually is pretty tender for most, and obviously make sure to get both sides. Next, we'll go into the plank position. So we'll start right past those hips. We'll be in the plank position like so. Abdominals slightly engaged to avoid from that back arching out on you. You're going to walk those feet forward, walk those hands forward, going forward and back right along that calf muscle. Again, this is usually one that's a little bit more tight than most. If you need to intensify, you can always kind of balance more so on one leg, which does kind of throw you off kilter a little bit. But once you get a feel for it and get the balance, it's all good. And then finishing up, we're going to do the IT band. Now the IT band gets done on both sides, obviously. This one's usually the most painful of them all. So the way you set yourself up is you get right past that hip bone. You don't want to roll over that hip bone because that will be painful. Take that bottom arm and bend it at about a 90-degree angle. You're going to take that top leg right on over, and then you want to envision yourself standing up. You want to have that body nice and straight. Some people kind of have those hips back. You want to again have that body nice and straight. You're going to use that top arm for additional support if you need, and you're going to roll yourself as close to that knee as possible, then rolling on back. Again, this one can usually be tight for a lot of people. There's very few stretches you can do to stretch out your IT band, so there may be a lot of knots. If you need to intensify because it's not very tight, then take both legs straight, just like so, going back and forth. Simple, straightforward. Again, make sure to get both sides. And again, take as much time as you like on each and every muscle group. Utilize this. Do it before each and every workout. And I recommend doing it most nights of the week as well. It'll definitely help increase your flexibility, and you'll be very thankful for it. Enjoy!